Good morning. This is Dr. McDaniel. I'm a board-certified obstetrician gynecologist in New York City, and I'm bringing to you all things health-related for women. Thank you for joining me at the corner today, and obviously I'm not at the office. It's Saturday, so my nose is itching because of allergies. It's Saturday, so I'm at the horse farm, and it's cold outside because it's January, so I'm in the car. Let's see, I discussed about 2 years ago in the presentation about self-breast exams, and I thought I'd bring it up again because I've seen a couple of younger patients in the last week or two who have told me they're not doing self-breast exams because they thought, air quotes, we're not supposed to anymore. So that's a yes and a no. Self-breast exams have always, for years and years and years, I mean, I've been practicing medicine since 93, and before that, medical school. So for 50 years, 50 years plus, we've recommended that women examine their own breast. And the recommendation, as I describe it to women, is just once a month so that you're not having a chunk of time in between the exams, but just 4 weeks, once a month, ideally a couple of days after the menstrual cycle, to do the self-breast exams. Now, we say a couple of days after the menstrual cycle because with the hormonal changes that occur before and during the cycle, you can have a lot of breast tenderness, breast swelling, breasts get fuller, breasts get lumpier, so breasts get more worrisome is the upshot for that one because of the hormonal stimulation, since breasts are a hormonal organ. So ideally, the 2 weeks before the menstrual cycle and the week of the menstrual cycle, you don't want to do your self-breast exam. You're going to find a whole bunch of lumps and clumps and tenderness that may worry you. So a couple of days after the menstrual cycle is the ideal time to do the breast exam because it's the least hormonal time frame. And when you do the breast exams, you're not looking for specific lumps, you're not looking for clumps, you're not looking for balls and blah, blah, blah. You're simply trying to make sure that how your breasts feel this month was how they felt the month before, month before, month before. So you're doing a month-to-month comparison because everyone's breasts are different. You can't say you're specifically looking for a green pea size lump. Some women naturally have tons of green pea size lumps in their breast. Sometimes when I do we call it clinical breast exam, when I do the breast exam for the patients, some women feel like they have a bag of chickpeas and marbles and nuts and bolts, a whole bunch of lumps and clumps throughout the breast. Literally, I can feel the balls rolling around when I do the breast exam. Others feel like it's just a bag of yogurt, so nothing at all. So anywhere in between that range, from one end to the other and in between, is all normal for that individual. So you're not looking for anything specific. You're looking for a change, anything that's different than what you've been used to feeling. So ideally, in the shower tub is going to be the easiest because most people don't take a shower with their bras on. So you're going to be naked, or when you're putting lotion on, if you're putting lotion on after you get out the shower, you're just conscientiously for a couple of minutes washing your boobs or putting the lotion on your boobs, and you're feeling to see if they feel differently than they did the last time you felt them, which should have been the month before, or if they feel pretty much the same. So you're essentially getting a gestalt for how the breasts feel from month to month to month. And I tell everyone, it's like Sesame Street. One of these squares doesn't belong because eventually you do that 5, 6, 7, 8 months in a row. You're going to get used to what normal is for you. And if something changes, there's a lump or a clump or tender spot that you normally don't feel or see, then you'll know that's not normal for you. It'll jump out at you like a red herring. So I also say it's kind of like the way they used to train people in government to detect counterfeit money. The way they teach them or train them to identify counterfeit money is to give them lots of actual, real, genuine money. So they see normal. They see all the different variations, old, new, worn, been through the washing machine, the dryer, blah, 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 been stomped on, folded up in someone's shoe. They see all of the different variations of normal dollar bills. Let me snap a little bit stronger than that. And the minute there's a false or a fake bill that comes along, it jumps out at them because it's not what they've been used to seeing. Their trained eye is used to seeing normal. Anything outside the norm jumps out at them. Same way with the breast exam. You do your breast exams every single month, month after month after month, the same hormonal time frame, which is the week after the cycle. You're going to feel the same variations in your breast. Something different comes along, you're going to notice it because it's going to jump out at you. So the recommendation by the American Cancer Association approximately 8 years ago or so was that women should stop doing self-breast exams. Now, that was a public health announcement. It wasn't for the improved health of the individual. It was for the improved pocketbook of society. And by society, that usually means insurance companies and premiums. We know historically that the majority of breast cancers are found by women doing self-breast exams because that just makes sense, right? If you're checking for a problem once a year, you're not going to find it as often as if you're checking for the problem 12 times a year, right? That's common sense. So when you just rely on the doctor to do your breast exams and to find a problem, you might find it if you're doing that every year, but you're not going to find it as quickly as if you're relying on your own hands to check every single month and coming in for a problem. I'm going to say, of all the times that I've had a patient with breast cancer, if it was palpable, now a lot of times we pick up breast cancer in a mammogram that you can't feel, you can only see it because of the calcifications or derangements, changes in the tissue structure and background on the x-ray, which is the mammogram. But of the breast cancers that you can feel, I'm going to say every single patient, not every single, but probably about 95% of the time, someone's come in because they felt something weird, either purposefully felt it because they were doing self-exams or inadvertently felt it because they were washing or what have you, or noticed something looked weird in the mirror. But they've come in on their own volition. I've agreed with them, there's an abnormal mass, and then it's turned out to be breast cancer. Even once I had a young woman, 28 years old, who came in because she felt a lump in her right breast. I always examine both breasts if someone comes in with a question about one. I did the exam on the right and I said, it doesn't really feel worrisome. Obviously, I'll give you a referral to get it evaluated, but it feels like a hormonal fibrocystic change. It just feels like a normal lump of the breast. I said, but on your left breast, there is another lump there, and that one doesn't feel like a typical, so we'll have both breasts evaluated. She was shocked because she did not feel the lump on the left breast. And of course, I'm only telling you this story because the lump on the right breast that she felt was normal, and the lump on the left breast that I noticed for her was breast cancer at 28 years old. In fact, it was very aggressive breast cancer because she'd been in for her routine annual exam just 5 months earlier, and I had not felt that lump. It wasn't there. And of course, at 28, if we don't feel anything unusual, then that's not the age that you routinely get mammograms, so it wasn't picked up on in anything until she came in with the lump on the right breast. I noticed the lump on the left, and that one was breast cancer. She felt bad because she didn't notice it, but I told her, you're doing the self-exams every month, which is good, and you came in for a problem, which is even better, and unfortunately, you did have a problem. It doesn't matter what side it was in. You only came in because you noticed something, and had you waited till the next annual, it would have been too late, honestly speaking. So the American Cancer Society is looking at the public at whole. So it's a public health announcement. They're looking at the forest, not the trees. And you're really concerned about the trees because you're concerned about your own body. So they made the announcement that women should stop performing self-breast exams around 8 years ago because of 2 specific reasons they literally stated. The first reason was that the majority of lumps women come in for were spending a whole bunch of money and time, and they turn out to not be cancerous. And second, they literally stated that of the ones that do turn out to be cancer, Most of those women could have lived with their breast cancer longer and waited until it was picked up on either a clinical breast exam by their doctor or a mammogram. So I think both of those don't make any sense for the individual. They only make sense for the public coffers. So you can decide whether you want to check for a problem once a year or 12 times a year to see if you have a problem sooner rather than later. And even though you can live with that cancer potentially without a huge change in the prognosis, whether or not you're comfortable potentially living with breast cancer long enough to have it picked up by the usual methods. So as I tell everyone, you've always had a choice to decide whether or not you're going to do self-breast exams. It's not a completely free country, but it's still a relatively free country. You still have a relative amount of free choice. So you can decide, and you've always been able to decide whether or not you're going to do self-breast exams. You don't need an entity to tell you that you don't need to do self-breast exams. So you need to think about why they're telling you you don't need to check for problems in your own body. But that's where that dictum has come from, and I still encourage everyone to do self-breast exams because that's the best advice. It's about health, not always about how much money insurance companies or taxpayers are paying. So I hope that was helpful information on, do you still need to check your own body? Do you still need to do self-breast exams? Thanks for joining me at GYN Corner. And almost forgot, please hit the like, subscribe, follow buttons if you enjoy the content on GYN Corner. Leave comments and ideas or topics that you'd like for me to address. Anything that's related to women and women's health, I'm more than happy to have set up a presentation on it. Have a great rest of your day. Bye.